So we've gone through a series of what I would refer to as pandemic response shifts since we started this journey together late January.
What's up, guys? Today is going to be a special day. Today is when the governor is going to tell us when everything can go back to being normal. Yes! I've been waiting all week for the governor to announce when things can go back to being normal. Woo! We're going to be free. I'm free at last.
So today we want to create a framework and pass forward a process that we've been having and that we've been engaged in for the last few weeks, and basically pull back the curtain on those private conversations and make them public. So you'll get a sense of the questions we're asking and the questions we need answered.
So this is what he gave us today. He gave us 6 phases today. Let me show you guys what it is.
But the framework is predicated on the ability to do 6 things. The most important framework is our capacity to expand our testing, to appropriately address the tracing and tracking of individuals, the isolation and the quarantine of individuals, using technology and using a workforce that needs to be trained and an infrastructure that needs to be in place in order to begin the process to transition. I'll talk more about that, and we'll be more prescriptive in terms of what that looks like.
So basically phase 1, he's telling us we're going to expand the tracing of the virus. Also, who has it and stuff like that. How far reaching, how many people got it. So, damn it! More people are going to have virus because we're going to trace it and find more people having it, more tests to get people.
It's airborne.
The second phase is maintaining our vigilance on protecting the most vulnerable populations in the state of California from infection and spread. Primarily our seniors, those with immune order issues and specific strategies and interventions around addressing the needs of our homeless as examples of addressing those vulnerable populations as a top priority.
All right, phase 2, he's going to maintain more quarantine towards the elderly and all the homeless. So if you're older, you're not going nowhere. And if you're homeless, he's going to probably spend more attention towards them and more medical stuff, put them in hospitals and stuff like that. So that's what's going to happen in phase 2. Man, my grandpa going to be on lockdown. My grandma going to be on lockdown. I ain't got no homeless friends, so. What do you do? But not me. Just kidding. Not really.
Number 3 is addressing, again, the ongoing needs of our hospital and alternative care delivery system to meet the needs of potential surges as we adopt new strategies, as we loosen the stay-at-home orders, ultimately and eventually the prospect of increase infections and spreads. We need to make sure that that infrastructure is protected and to make sure that those assets are well prepared. PPE, not just, again, the masks and ventilators and gowns and shields, but also making sure that we have a myriad of other protective gear for that workforce, and to make sure that we're capable from an ICU perspective and hospitalization perspective to meet any additional surges.
Okay, phase 3, we're going to contribute more towards like our hospital personnel, so our health professionals and stuff like that. We're going to get like a lot more gear, masks, ventilators, gowns, all that kind of shields, all that kind of stuff towards our health professionals and our nurses and all that kind of stuff. They're going to take care of us. So, okay. Less spread because they're going to have more protection. I get it. Okay, Governor.
The 4th frame is to continue the work that we've been doing on a weekly basis, and that is to engage academia, to engage our research partners, to engage those that are on the front lines, and they happen disproportionately to be here in California, companies like Gilead, companies like Genentech, credible operations of support that are coming from our hospital systems, UCs, Stanford, USCs, Scripps, and others, including our national labs, to make sure that we're really advancing and continuing to promote more protocols on therapeutics, which are profoundly important as we bridge ultimately towards the herd immunity and the vaccine within, we hope, the next year or so.
All right, phase 4 is going to be more work and help towards our scientists and our health professionals that are trying to figure out the disease. So try to get vaccines for everybody and let everybody get cured. So we're going to put more funding and research into our scientists and all that kind of stuff. All right, which is cool. Good. All right, let these guys figure out what's going on. Get us healthy. We need a vaccine.
Number 5 is the incredible importance of redrawing our floor plans. And that is quite literally a responsibility if we are moving into a next phase of our businesses so that we can practice safe physical distancing within the premise of a business, within and around a school site, and facilities large and small, public and private, all throughout the state of California. So quite literal strategies, guidelines, and expectations on what physical distancing would look like within those facilities, not just broadly out on the streets, our parks, playgrounds, and in our coastlines.
Okay, phase 5. I'm happy about this. I'm excited about phase 5. So this is going to be more getting back into our businesses and getting back into our normal day and our kids into schooling and stuff like that, but practicing social distance in between schooling and all our business and stuff like that. So maybe less workers or less kids in each class, more teachers, so maybe more jobs, something like that. It's going to be cool. I like that. It's going to be tough, but I think we'll figure it out. Whew, let's go. So I'll be back at work. I'm like, hey, man, keep your distance, 6 feet. I got measuring tape, 6 feet, babe.
Get back, you don't know me like that.
Finally, our capacity always to turn on that faucet again and reinstate more vigorous controls. And that's just a process that will perhaps be the most challenging if indeed we lean in, but we have to then lean back out as we toggle from stricter to looser interventions, back and forth. As things change, as data comes in, as health concerns make themselves real in terms of that data, or at least more obvious, our capacity to pull you back in and to encourage people to advance the social distancing, the stay-at-home and physical distancing that has gotten us to this point today. And so that's the framework. Those are the 6 frames of focus that we will monitor and that we will process as we make the determination through this process of architecting a next phase in this pandemic that we will be processing, at least making more public here today.
Phase 6, I guess, is just how we're going to get back to everything normal. That's what he means by loose interaction. Loose interaction. We'll see. From strict to loose, we'll see. So we thought we were going to have a date when we were going to go back to being normal, but nope! Not happening. This is crazy. We ain't never gonna get out here. Help me. When am I gonna be free? When am I gonna be free? Help me. When am I gonna be free? And we got all 6 steps to get back to being normal? Man, I'll see you guys in 2 years. This ain't happening. We on lockdown.
And I get locked up.
I'm gonna freak out. So basically he said they still don't know what's going on. A whole bunch of stuff beating around the bush of what's gonna happen to get to everything to be normal. But ain't looking good, guys. Man, let's pray. Damn it. I knew this was going to happen.